This is Dr. Mahesh Padsalge from Navi Mumbai. We will be talking about COVID-19 and diabetes connect today. As we all know, COVID-19 is a name of the disease and SARS-CoV-2 is a name of the virus. COVID-19 disease is rampantly increased across the world in India, in Maharashtra, Mumbai, and everywhere in Maharashtra also. If you just see the clinical features of COVID 19, they are very non specific. But the good thing is, 60% of the patients are asymptomatic even though they are positive. 30% patient get symptom of upper respiratory tract infection like sore throat, cough, breathlessness, fever. Fever is very important symptom of COVID-19. Now, if you just check the investigation, in investigation, CBC gives a good important finding where you will be seeing lymphopenia, and if your lymphocyte absolute lymphocyte count is less than 1000, it goes in favor of COVID-19 disease. At the same time, we need to find out, see the level of LDH, level of D dimer, then we need to see level of TROP-T. These are the investigations are very important. Now, if you just see the prognostication of COVID-19 disease, many of the asymptomatic patient goes to home in between say around 10 to 14 days. But some of them, if they get infection or the symptoms goes slightly complicated, they try to get involvement of patchy bilateral pneumonia, which actually causes hypoxia to the patient. So hypoxia is a major injury which is actually happens to the patient, and that is the reason oxygenation by different kind of modalities is one of the great and best important treatment for COVID-19 disease. In that situation, if you just find out the investigation how we diagnose COVID-19, the clinical features which concludes COVID-19, the three major symptoms are very important. Fever in 98% of the patient, breathlessness and cough in almost around 60% to 40% of the patient. What are the investigation? Investigations can be done in two types. In India, we do only RT-PCR of COVID-19 virus, that is SARS-CoV-2 virus, that is severe acute respiratory syndrome coronavirus 2. Here, we really see the antigen or the RNA copies of virus. So we really calculate the number of viruses, how many viruses are there in your body. Next test which will come in India is a strip test. This is very good test for testing all over the India, which will be coming in the less cost in future. Here we are going to test IgG, IgM and IgA level of this COVID-19 disease. This test probably will come in 500 to 1000 rupees as per my experience of all other strip tests. Why we should be doing this test to diagnose the COVID-19 disease? Now, what is the treatment? The treatment is till now there is no treatment in advocated by any of the bodies, but treatment depends upon the person who is treating, and there are many different guidelines are there as per the countries. But at present we have some antiviral drugs like lopinavir, ritonavir, remdesivir and favipiravir, and then we have anti-malarial drug which is called as hydroxychloroquine, which is been again used in India for prevention purpose in healthcare professionals. So many of the patients are taking this hydroxychloroquine for rheumatoid arthritis and diabetes for years together. So if any of the side effect would have been there, then this drug would have not been there in the market. And it is not only available in India, but it is available all over the world. Hydroxychloroquine, we all know, it is an anti-inflammatory drug which we use for years together for rheumatoid arthritis or systemic lupus erythematosus disease. So when anybody gets COVID-19 disease, at some point of time from day 7 to day 10, it has been found out it can cause cytokine storm, and which can progress to SARI, that is severe acute respiratory syndrome or infection. So probably it is like that, that cytokine storm can be halted because of this hydroxychloroquine. This is one hypothesis. Hypothesis number two, many of the book from the inception of hydroxychloroquine hydroxychloroquine in pharmacological books has been told that hydroxychloroquine can be used as an antiviral drug for influenza and common cold also by years together. Third important hypothesis of mechanism of action is that it has been found that this SARS-CoV-2 virus actually enters inside the red blood cells and it dissociate oxygen and hemoglobin. So basically it is causing dissociation of this hemoglobin from oxygen and it is trying to make this hemoglobin to form oxidative form of iron, and this free iron particle are ready to cause cytokine storm as well as inflammatory process ignition. So if you use hydroxychloroquine enters inside your cells and it causes acidic medium inside the cells, and it has been found out that acidiform or acidic media inside the cells prevents the replication of any viral load inside the cells. So in terms of hypothesis, the third point is also very important, that at the end that hydroxychloroquine stops the replication of virus inside the red blood cells or all over the body. So oxygenation is important part, but at the end of the topic, I will just tell you the steps of the treatment are diagnosis, isolation, contact tracing, again diagnosis and isolation. Isolation because it is very highly infective virus. So I will tell advise all of you or listeners that you be safe at home. Keep almost 1 to 2 meters of distance. Wash your hands multiple times if you are touching somewhere. If you are at home, wash your hands at least 3 to 4 hourly or at least before eating, and be safe. Thank you so much.